Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. There are moments in medicine that stay with you, not because of the science, but because of what they teach you about people. Dr. Monique Nugent is a hospitalist who has built her entire career around those moments. She reminds us that medicine doesn't just happen inside hospital walls. It happens in the space between policy and people, between what we can prescribe and what our patients actually have access to. We talk about how her frustration with those gaps led her to pursue a master's degree in public health at Harvard. She also opens up about her nonlinear path into medicine, the detours that shaped her, and what it really means to do despite fear, despite frustration, and despite the negative opinion of others. This is an episode about resilience, about redefining success, and about finding your place. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Dr. Monique Nugent. Dr. Nugent, thank you so much for joining me on Shadow Me Next today. We've already been chatting as we do, and it's just, you're an amazing person. I know your patients just adore you.
I hope. I think the nature of what I do, I know I have unhappy customers as well.
That would be a great conversation to have, because when you have an unhappy customer at my office, they walk out 20 minutes later. We have 20-minute appointments. They're there, then they leave. Unfortunately, your customers, so to speak, your patients are there a bit longer, right? You are a hospitalist, and your patients stick with you for a bit. Tell us a little bit about what you do, what your day looks like on the regular.
Yeah. So I am a hospitalist. I love what I do. But it's not a field that a lot of people know about until they interact with us in a hospital. So I'm a board certified internist, but I only see patients who are hospitalized. And so I practice the specialties called hospital medicine. People call it hospitalist medicine. And I'm always like, do you call it cardiologist medicine? No, it's cardiology, right? So the specialty is hospital medicine. And it's great because I get to see so many different things. I remember when I first graduated residency and I was talking to a friend who had just graduated surgery residency, and, we're together, we're new in attendings, and he was like, man, this is great. This is what I want to do. And it's good because I'm seeing things that I'm used to. Like I have a lap chole today. And I said, I have the exact opposite. I have a refeeding syndrome on my list. I've never treated a person with anorexia who needed to be refed. I have brand new renal failure that no one knows why. I have, things that I'm used to like COPD and CHF, but my list was full of things that I hadn't seen, but I had the tools and the skill set to work through it. And I continue to see things that I haven't seen before, or iterations of it, presentations that I haven't seen before, versions of how people interact with their diagnoses. And I love what I do because I continue to have the skill set to work through it, but also help my patients and their families work through it. But yeah, the average hospital stay in this country is about 4 to 5 days. protracted hospital stays can be due to people think just medically, but it's a lot of social reasons.
Mm-hmm.
People are hospitalized for like an extended period of time. Right now in my hospital, we have a very lovely gentleman with dementia who essentially is living there because he doesn't have in the financial means to be placed somewhere else. His family can't care for him. And there are like little to no inpatient psychiatric dementia beds run by the state. So they're trying to figure out the place to send him. And it's been weeks and weeks and weeks that the gentleman's been living there, but on average, really active medical interventions are about 4 to 5 days or the amount of time that I'm seeing my patients.
Thank you for describing that. You've worked very hard in your career to become a fantastic physician, and you actually have your master's in public health as well from Harvard University. Is You're describing these incredible treatments
Mhm.
that you offer and diseases that you diagnose and really mysteries that you solve. But you're also describing some things that maybe we wouldn't think we would be dealing with as a physician, as a clinician.
Yeah.
Is that frustrating to you, or do you just kind of accept that as part of your role with serving and helping people?
So the reason I went to do my non-clinical fellowship at Harvard, get my MPH, learn about healthcare policy and management was because I was getting frustrated as a med student, as a resident, as a young attending, and I didn't have the language. And I was speaking to someone and I was like, these things that are happening to these people outside the hospital. And she said, well, those are called social determinants of health. And I was like, no one has said those three words to me in
Mm-hmm.
that order. Tell me more. And that's where I started to really learn that my frustrations were warranted because if I say you're hospitalized 5 days, right? There are still 360 days of the year you're not under my care. You see patients for 20 minutes. I'm not going to do the math to say how many more minutes are left in the year, you know, but essentially the things that happen outside of your office, that happen outside of the walls of the hospital, really are the things that determine a patient's health,
Mm-hmm.
how well patients will do. And when I started realizing that my frustrations were warranted, I remember being on the phone with an insurance agency as a second year resident, trying to convince them that to hospitalize a patient for Lovenox, which is a blood thinner. It's an injection blood thinner. And I'm old. It used to be really expensive, so it's not that expensive now, right? But like I'm on the phone in the emergency department. I'm like, this person doesn't need to be hospitalized. We can just give them Lovenox at home. And they wouldn't do it. They were forcing this person to be hospitalized, which was taking them out of their life. And they were telling me I'll have to leave because if I don't work, I don't have money,
Mm.
and it was just like, wow, it is. It's all this big machine that we've built that we think we give power to is not it, right? The hospital, the clinic, that's not where health occurs. It's not where health is maintained.
Mm-hmm. Mm-hmm.
It's outside of the walls and learning how we can support patients and ourselves in the long run by changing the way we think about healthcare, by changing the way we understand how legislature interacts with healthcare, how policy everywhere from national to local to hospital-based policies, interact with your healthcare and your ability to care for yourself and your loved ones as time goes on. Uh, it really, I will say, it hits everybody. I
Mm-hmm.
haven't met a clinician worth their salt who hasn't picked up on this,
Right.
who hasn't been like, I can't prescribe you a better life. I can't prescribe you better insurance. This is the situation, and I'm frustrated because I can't prescribe you consistent food, like consistent safe housing, clean water.
It's so challenging, and it does contribute to burnout. But I'm so grateful to hear that you took what very well could have contributed to your burnout, and you're stepping away from medicine entirely. And you said, you know what, let me seek more education on this, and let me see if perhaps I can contribute to this solution for your patients. I'd love to hear your non-clinical fellowship actually contributes to your care. But before we talk about that, let's go back. You mentioned being on the phone with insurance companies, and it just something inside of me died a little bit when you
Yes, I
said that.
know.
But as a physician, especially as a hospitalist, I would imagine you work with a team of people and these social detriments of health and working with clinical social workers, things like that. Can you describe the team of people that are surrounding you every day when you go into work?
Yeah, so hospital-based care is very team-oriented. Uh, Outside of your physician, your therapist, your physical therapist, your speech therapist, your occupational therapist, big part of the team. They really do help, again, determine how we can set you up for success after
Mhm.
you're hospitalized. Do you need to go to a rehab? Do you need like a shower chair to be safe in your home?
Mhm.
Do you need a different type of texture to eat now that you've had a stroke? How can you communicate, right? So these therapists, these are really key to making sure that we're keeping patients safe, we're advancing their care. Clearly, the bedside nurse and her team of nursing assistants, and people just think like, oh well, they're nurses, they're always there, but really they're always in my ear as well, telling me all the things that are happening. And it doesn't just have to be like, oh, he's bleeding, oh, this wound. It's like when his sister shows up. There's a lot of tension in the room and he gets very anxious and like, do we know exactly what's going on there? Like,
Mm.
oh, he says he has a home, but actually his brother showed up and was like, no, he got kicked out of his halfway house. So you have to talk to the social workers. So they're keeping an ear out, and letting me know kind of everything, the whole picture that goes on. And then there's my favorite people who I dedicated an episode to, which is case management. Some people call them caseworkers. In some hospitals, they may be a mix of social workers as well. So I'll kind of put them together. And their job really is to understand what your medical needs are and what the social needs are, and where you can get all of those things met through a combination of insurance resources, community resources, and personal finance resources. And so I can cook up any plan. I can come up with anything medically. But if you don't have access to that when you leave here, if you're not going to be able to see that specialist, if you can't access that medication, then I'm just over here, satisfying my own curiosity and feeling
Mhm.
like I'm doing a good job. But really, the case managers keep me in line and they're like, his insurance won't cover that. Like, or like, that cardiologist is outside of her network. We've got to be sure we can get people the things that they need to be successful after a hospital stay.
And the healthcare team, it just reminds me of the rather silly phrase, it takes a village. It really does take a village to raise kids. It takes a village in medicine. And caseworkers really are the heroes of the story a lot of times.
Oh yeah.
We need them so much. Dr. Nugent, how long have you been in medicine? How many years?
Oh gosh, 16 years?
16 years.
16, 17 years? Yeah.
Absolutely incredible. So I'm going to ask you to stretch your mind way back to 16, 17 years ago when you really first embarked on this journey. Is this what you expected? Is this what you wanted when you first realized, hey, I want to go into medicine? Did you even want to go into medicine in the first
Yeah.
place, or were you kind of just did you fall into it?
I had a lot of I don't know what you would call them on the road, but like detours where I
Okay, yeah.
got off and then I got back on again. So I went to college very much wanting to be pre-med and thinking
Mhm.
this was the thing I was going to do. I struggled a little bit my first year in college and then picked up speed and then decided to drop all my pre-med requirements. I was not going to be a physician anymore. I was really steeped in neuroscience research and I wanted to be a clinical psychologist and do research. So I was like, no, I'm not going to take physics. Physics was the last of the pre-med requirements that I had. And, I'm sure my parents will tell you now that like, oh, it's part of the picture, but they were unpleased at that point in time. And I haphazardly applied to a number of PhD programs and realized that I didn't get in when everyone else got interviews, and I didn't even get like no thank you emails. I was like,
Rude.
well, I guess Penn State didn't want me. Like, guess I'm not going to have a PhD. And I did a post baccalaureate research position at the NIH. Again,
Yeah.
focused. in neuroscience. I was at the NIMH, National Institute of Mental Health, doing fMRI research, and this was really where I thought I wanted to be, but got bitten by the medicine bug
Hmm.
again, and then got back on track. After college, I took my physics classes at a different institution, you know, and applied to medical school. And then, went to med school and I started medical school. I was like, I'm going to be a surgeon. I was like 100% going to be a surgeon. And realized really quickly that there was no way that I should be anybody's surgeon. Like when I got into the OR as a med student, a place that I thought would be amazing, I was petrified. I was hot all the time. I was like, why is it so bright in here? And like, you can't sit down. And it was stressful. And I was like, oh, I don't need to be here. So, um, decided to do something else, tried out a bunch of things. And I actually started residency in psychiatry. I was a psychiatry resident for a year at UC San Diego, where I love San Diego. I love psychiatry, and I still have nothing but the utmost respect for psychiatrists, which is a totally different conversation. But quickly realized that I wasn't going to be the type of psychiatrist I envisioned myself being. Re-entered the match and
Wow.
went back, did internal medicine. And when I did internal medicine, I thought I was going to be an intensivist, that I was like, I'm going to do ICU work. And I love the ICU. And again, have nothing but the utmost respect for my colleagues in critical care. But every time I was on my ICU rotation, I lost weight.
Wow.
And I took that as a sign that it was just not meant for me. It was just very stressful. I wasn't
Hmm.
sleeping. I wasn't eating. I thought I was enjoying the experience, but my body was telling me something different.
Mm.
Um, and so I found my love of the hospital, and I just kept doing hospital medicine, and it's been a great career. So I tell my like random on-off story because I want students to hear that it doesn't have to be linear. Like I work with students from Tufts School of Medicine. And I spend all my time telling them you don't have to have the answer today. You just have to have today's answer. That's it.
That's
And
beautiful.
it doesn't have to be linear. You can get on, off, find different ways. Make the journey your own. Listen to your body, your spirit, listen to what really is happening in you when you are doing these things, and you'll find the place you need to be.
Absolutely. Absolutely. And it's so perfectly timed because the number one question I get from student shadows and students that I speak with on college campuses is, Ashley, am I behind? Here's what I've done, XYZ, ABC. I'm a sophomore in college. Am I
Yeah.
behind? And I'm just so grateful for your honesty and your descriptions of why certain things didn't work out for you, because it's not always, I mean, you didn't get a D on your test in surgery, and that's why you're not a surgeon. It was an experience thing. You actually had to
Yeah.
be there to
Yeah.
experience the fact that this is not for me. So no, I think we would both tell these students, no, you're not behind. You're exactly where you need to be.
Yeah. Yeah.
It's
I
just a
don't
matter of exploration.
there's there's something about the trajectory of going into medicine, science, and academia that makes you feel like you have to have it like all lined up, right? But then you meet people who have done all sorts of amazing things and you think, wow, that person's amazing. They've done all these amazing things. But in your head, you have to be on this line,
Yes.
right? So if you can acknowledge that, like, wow, someone has done amazing things, and that amazing thing was on the other side of the line. That amazing thing veered them off track a little bit. That amazing thing was in addition to. Why do you have to be on the straight line? And I get it because when I was a med student and when I was in college, I had the same exact feeling.
Hmm.
I had the same exact. So I do spend a lot of time with my students and any student saying like, as long as you have two things. One, forward trajectory. As long as you're doing something.
Hmm.
The second you stop doing something, then that's a different issue, right? But as long as you're moving forward, I don't care where you're moving forward, but as long as you're moving forward, you are good, right? And as long as the second thing you have um, is the joy to be doing that,
Mm.
right? like it's not going to be always joyful. Like don't think that like you're going to wake up and be like, I love med school. This is the best. Like no, in no way. There's going to be times that you are just like, I can't do this. I can't stand this. I'm in just not a great place. I don't want to be doing this thing. Get through that day. Get a good night's sleep, right? Like a good night's sleep.
Mm-hmm.
And when you wake up, if you can do it again, then do it. It's the morning that you wake up and you're like, I really can't. Listen to yourself then,
Mm-hmm.
right? Because there's lots of reasons why maybe you can't. But as long as you're like, I got beat down yesterday, I got knocked down, but I took my shower, I had my oatmeal, I had my sleep, and I'm ready to try again, then do it. As long as you're moving forward, that's all you need. You don't have to have all the answers. I promise you, you really don't. I'm 45 and I don't have any answers still, like
Mm-mm.
ever. Like
Oh, well,
never.
you're describing the beat downs and the wake ups and try again. I'm like, yeah, that's sounds like motherhood, first of all. And it
Yeah,
sounds like
very
working in
much so.
medicine, second of all,
Yeah.
and being a spouse and just life I mean, that's life, you know?
Mm-hmm.
Oh,
Yeah.
that was so perfect. While we're on the subject of offering good advice, we have a segment on the show called Quality Questions, which is where we talk about interview questions that we've heard in the past in hopes that it will help the person who is about to sit for their own pre-health interview, whether it's med school
Yeah.
or PA school or nursing school or a speech language pathology program. Dr. Nugent, do you have an interview question that is just burned into your memory that you would like to share with us?
Before we hear what Dr. Nugent has to say, keep in mind that there's more interview prep, such as mock interviews and personal statement review, over on shadowmenext.com. There, you'll find amazing resources to help you as you prepare to answer your own quality questions.
My first med school interview, I ended up, again, everyone's going to be like, really? Ended up crying in the bathroom and calling my mother because um, the interviewer asked me, why do you think you would succeed here?
Hmm.
And I didn't have an answer for him. And I was just like, because I will try hard and I will work hard. And he said, you don't think everyone is going to do that? And I was like, uh, uh. I didn't have an answer. I just sat there in
Oh,
silence after he said, you don't think everyone's going to do that?
mm.
And today, years later, I think I would have told him, I ended up not going to that medical school, but the reason I succeeded in medical school was because I came back the next day and
Yep.
because I did it despite being scared. I did it despite being mad. I did it despite I'm getting choked up, feeling insulted. I did it
Mhm.
despite, right? And not to spite people, but despite of that,
Right.
despite of all the things, I still did it.
Mhm.
And if that can be you, like that, you will do it too. I also think it's kind of like an a-hole question to say to somebody.
Right? I was thinking the same thing.
Like, you don't think everyone's gonna do that? I was like, oh, he's right. Everyone is gonna do that.
I know.
But yeah, I think I would tell him I would be successful because I'll do it despite anything else.
Mm-hmm. Mm-hmm.
Yeah.
No, and I'm so glad. Thank you for sharing that story because, um, God, I would have loved to have heard these things before I had some of these interviews. I had brutal
Oh
interviews
gosh.
and moments like that where you hear, okay, this is a question people ask. People are not always kind in interviews,
Yeah.
and people freeze. And you know what? Then they become really amazing physicians despite freezing in one interview
Yeah.
question. It's just, and looking back, yes, we would love to give an elaborate answer as to why, but I think what makes things the best, looking back as clinicians and why we talk to these students, is because we are proud that we can answer those interview questions now.
Yeah.
I mean, the reflective nature of this show, and the reason I love quality questions is because these moments happen all the time. We describe a hard interview and say, you know what, now I have a really great answer for that. because I've been doing this for 10 years. I've been doing this for 17 years. And I'm proud of what I do. And I'm proud of how I got here. And that journey is long and it's grueling. And like you said, you don't wake up with rainbows and butterflies coming out of your ears every day. But we did it despite B. And it makes me so glad to be a part of this community still. Thank you for sharing that quality question. It's absolutely amazing. Let's jump into prescription for admission. And I want to talk about your book first. And actually, I would like to read a little clip. Yeah. It says, with the right knowledge, your hospitalization can be a positive experience full of the comfort, communication, and compassion you deserve. And this is you, the patient, right? Yeah. Dr. Nugent, tell me why this book was necessary. Why did you have to write this book?
So I started writing this book during the pandemic. I was at the time the associate director for the Division of Hospital Medicine at my hospital. And we had like 10,000 meetings a day, if you can imagine all the things we had to do to really pivot essentially every practice that we had in the hospital. And one of the things that happened was we closed the doors, right? Family members could not come in as much as they were. And people think that like doctors and nurses don't want families around. Wrong. In the hospital, we love having family and support system around our patients. There are so many things that families and support systems tell us our patients don't tell us. For instance, I've never met Nana ever in my life. And I may think Nana looks great and she's chatting it up with me. And someone else would be like, she's very confused because my dad actually lives in Minnesota. My dad no longer lives down the street, things like that. And so family members also want to talk to us. And I was like, I'm going to write a book teaching people how to navigate the hospital during COVID. And as I sat down to write the book, what I found was I wasn't saying anything particularly new. And it wasn't anything particularly COVID-based. It was all hospital-based. I've practiced in academic centers, VAs. I'm now at a community hospital. I also trained a little bit at a community hospital. Like I have been in hospitals on the West Coast, on the East Coast, almost every iteration of type of hospital, other than pediatric hospitals that I've practiced in. And it's always the same problems over and over and over. So actually in the book, you won't find the word COVID like at all.
Wow.
Because it ended up being more guide and manual for hospitalizations in general. And the reason that I really think people need it is because we're all going to end up in the hospital. Like nobody ever wants to talk about it because no one likes talking about being sick, getting hurt, having a heart attack, finding out they had a cancer, right? But the hospital is like the DMV of healthcare, right? At some point in time, you will end up there. Even if it is to have a baby, at some point in time, you will end up in the hospital. And how you navigate that will determine the next thing that happens, right? Hospital stays rarely make things easier. They make things different. And you have to get to the version of different that works well for you. And that's really what I want people to get out of the book.
That's fabulous. This book is available on Amazon. And it's such a great resource, not just for patients and their families, but I think for young clinicians, for students looking to medicine in the first place. I work in dermatology. I don't work in a hospital, but a lot of my patients have just had hospital stays. And you know what? They come out sometimes really thrilled with the new direction that they're moving in. Like you said, their different plan. Sometimes they come out traumatized. And just to have a better understanding of their experience for me, I'm so grateful for this book and what you have. And not just this book, an incredible Instagram account, which of course, after speaking with you, the handle makes sense. It is the happiest hospitalist with underscores. And the resources here are incredible, Dr. Nugent. Thank you so much. You talk about things like, why do patients really get admitted? And are you managing your meds safely? Well, my God, I had a patient the other day, they had about 20 meds on their list of medications. And these are things that maybe patients are afraid to ask, or maybe people don't know, or clinicians need better tools in their belt for how to discuss these things. So this is an incredible resource. Both of these, you're also on TikTok. Talking about Instagram, and I actually, since you speak with students so often, I would love to chat with you about this. Let's talk a little bit about social media and medical content consumption right now. as a physician who's been doing
Mhm.
this for a really long time, you've seen the growth of social media. You've seen really this new generation of students who are consuming this content. What's your advice to them when it comes to looking at things on social media?
Yeah. I will admit that I'm kind of realizing I'm an old fuddy-duddy sometimes with my opinions about social media, because I've had several people say to me, well, it's really the medical institution's fault that people look to social media for health advice. And I get it. I do feel that there's a lot of mistrust in the system, which
Mhm. Mhm.
earned over time, and hopefully we're working to, earn back trust.
Mhm.
But like the thing that is really strange to me is that it's not a place where you have to know things. You really don't have to know anything. You
Mhm.
just have to be there. You just have to be on. And because of that, we've seen really dangerous advice given out. We've seen people, everything from trends, when kids were eating Tide Pods and
Yes.
like cups, not cups, spoons of cinnamon and stuff like
Mhm.
years and years and years ago, right? Those trends are really dangerous. To some of the health advice that people put out that can be quite detrimental. Um, and so I always tell people it's fine to think that that is doing your research,
Mhm.
but then take it and continue to do more research. Do more research on that person and figure out why you should be listening to that person. You know, people's values on why they should listen to people are very different from other people's values, right? Some
Mhm.
people value my master's degree from Harvard, my medical degree from Loma Linda, my leadership positions. Some people value that and say that that is why I should trust her because she's done the work.
Mhm.
Other people look at me and would say you're an insider, and that is why I don't trust you,
Right.
right?
Precisely.
So, so you have to figure out your value system to figure out why you should be listening to that person, but make sure that you you know why you are listening to that person, right? Make sure you know why you are seeking the information from that person.
Mhm.
And I mean, like, I get sucked into it too, right? Like, you see these like people on social media who have great physiques and they're like, I I'm like, I get sucked into the workout ones. They're like, do this type of squat and like stand on your head and boom. And then my husband finds me in the basement trying to do these moves that are just going to end in injury, you know? And he's like, what are you doing? I'm like, this lady on Instagram said, I get it. I get it. I get why we get pulled into it, you know? But I would always say, like, make sure you know why you're listening to that person and why you trust that person. People's values are all over the place,
Mm.
but as long as it's aligned with your values, that's going to be important. And so I value what I consider to be high yield information that's evidence backed. And so therefore, I'm looking for people who have access to that evidence, understand how to synthesize that evidence, and can then feed it back to me in a high yield way, right? Those are the things that I value. And so you have to figure out why you value things and why you're listening to that person.
That is the greatest advice that I
Oh,
have ever heard about social media in medicine. Thank you for sharing that. It's so true. A lot of these things, a lot of these ideas that we are hearing maybe initially sound really, really good, but like you said, you need to find out where those ideas came from. And if it's a person, you need to know a little bit about that person.
yeah.
And it's not just titles, like you said, it's more than that. It's their experience, it's their leadership, it's what is driving them.
What is
And
driving them?
it's not hard to find. It's not hard to find that information out. It just takes a little bit of effort, which is key. Dr. Nugent, this has been absolutely incredible. Such an amazing time. I will tag how to get in touch with you in
Oh,
the show
thank
notes
you.
below. But thank you. Thank you for what you have done, not just for patients, but for students as well. The happiest hospitalist, the title suits you. It is absolutely
Thank
amazing.
you. Thank you. This is really, I was very excited to talk to you. I'm excited to talk to students. You guys who are listening, like, it sounds cheesy, but you're the future,
Mhm.
right? You get to choose what this institution of medicine looks like. as we go on. And I'm excited to see how they continue to shape medicine so that medicine can really live up to the practice and goals of itself.
Absolutely. Dr. Nugent, thank you so much.
Thank you, Ashley. This has been great.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.